name is Aiko, the World of Wellbeing, and today we are going to be going all the way to the front line, of the COVID-19 pandemic. And we're going to be chatting with doctors today. Ladies, introduce yourselves.
Hi, my name is Precious.
Hi, I'm Renua.
Morning, ladies. Just a courtesy call from the Wellbeing to see how you are doing. So obviously here we are, week 5, week 6 of the pandemic. 6?
6, I think.
Technically, It started in December, but we'll go with 6.
We'll go with 6. Okay, we'll go with 6. But I want to take us all the way back to the beginning of week 1. So you guys are doctors. First of all, what doctors are you? Tell us what kind of doctors you are.
So I am a specialist registrar, and in very simple terms, what that means is I am specializing in an area within medicine. So I look after patients with kidney problems, so patients on dialysis, patients who've had kidney transplants, and patients with a whole host of other kidney conditions. Within my training, I also have very broad general skills. So I also look after patients that have non-surgical problems in hospital. So I guess you can count that my skills are very in tune with frontline working. So I guess I can class myself as a frontline worker at the moment as well.
Yes, got you. And you, Precious?
Well, I am a GP and I currently work as a GP, and I also work as a medical student tutor. So as a GP, I work in regular but different practices through the week. I have some patient-facing roles and I have some roles that are non-patient facing. And if you've ever been to your GP, whatever you went with is what I look after. So lots of different things, broad, from babies, old, new. So that's what I do on a day-to-day basis. I've had previous experiences working in hospitals where I've worked in different specialties, but at the moment my day job is in general practice and looking after my students.
Okay, fantastic. So we're coming to you from the aspect of well-being. It's week 6, you're still standing, so it's a testament to your strength and the goodness of God. So that is fantastic. Thanks for all your hard work. But take us back to the beginning, those emotions, your first day at work. You're going to be possibly facing patients who have coronavirus. As doctors, as frontline workers, what were those emotions? How did you feel going into work when it came to going into work those first few days? Let's start with Renua.
I think for me, if I had to be honest, for me, it wasn't a feeling of fear at all. But I think that's really just a testament to my personality. I would say I'm quite a strong individual naturally. So I wasn't frightened of my own circumstances. I guess when you work with other people, they feed off you as well. And there was definitely mixed emotions amongst like my colleagues at work. So you could tell people were just, slightly more anxious than normal. Doctors don't like uncertainty at all. So, so coming into the unfamiliar wasn't what we like at all. So we like to be prepared, we like to be armed, we like to know what we're doing. So definitely walking into an environment where we weren't really sure what could happen was unsettling, unnerving. And I would say personally where I work, it's a very supportive environment. So I think we were prepared on a daily basis as much as we can. We were definitely made aware of the situations in timely manners, and all the necessary steps were taken in place to ensure our safety as well. So I felt reassured, and but amongst that there was a heightened level of anxiety as well.
Okay. Okay. And you, Precious?
Well, for me, I would say that as a GP, one of the things we're supposed to do quite well is to deal with uncertainty. But this was on a whole new level. Rules changed as we were speaking to patients. So for me, I remember, normally I work in different practices, but this week I was in the one practice all week. I made that decision in November of last year. I didn't know there was going to be a pandemic, but I was in the same place that week. And I just remember we had daily meetings and things were changing as we were speaking. And you know, you'd speak to somebody and you would be asking in the morning, you'd be asking questions about what countries, what countries they'd been to. And then the next day you're like, right, we don't need to know about what countries you've been to. It doesn't really matter anymore. And so many different things. So for me, the feeling was sort of anticipation, sort of thinking, will I know how to answer the questions that people have? Keeping up to date with lots of things that just kept coming through. How's it going to change? How's it going to change for me? How's it going to change in terms of the advice that I'm given? If I want to make a decision about one thing, do I change my mind about how to make that decision? Will I know how to keep people safe? Will I know whether, you know, are the services still open? Can I refer somebody here? Is this what's happening? And just a sense of an awareness that even though we're used to dealing with change, there was just a sense that things had changing and it was evolving and you had to keep up to date with things. So it was that sort of uncertainty with that. And as time went on, you realize that even though we had the uncertainty, I was also quite eager. I was quite eager to go to work. So like you were saying, we're used to dealing with lots of different things, but I thought to myself, well, I wanted to know what was happening. So you were sort of in your emails, knowing what was happening and trying to keep up to date so that you can then actually answer the questions on the phone. Because somebody would phone you and say something like, oh, the news has just said this. And you would say, yes, the news has just said this, but this is the situation at the moment. Just trying to keep up to the pace with what everybody else was doing.
Yeah.
So I was eager to go into work, and I've got a little mirror that somebody's given me that has the serenity prayer on it, and I'll just read it. And it says, God, grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. And actually it's there, and I see it most days. And so you go into work with the mind of, yes, there's lots of different things that are uncertain, and people will talk about COVID, they'll talk about everything else. But it's knowing that you just kind of go to work and then you just start and you continue. So you're used to things being different, but now it was just the pace at which it was changing and knowing how to deal with your own emotions, but while sort of saying, well, people are phoning you, you're the doctor, so you need to know. And so just that awareness of, yeah, this is what I do. You just start that process and keep going. So uncertainty, but an eagerness to do something and be involved. Mm-hmm.
Actually, talking to Precious right now is really interesting. So because Precious is based in the community, her line and how she works is very different from mine. And actually speaking to her right now, I can almost relate in some aspects, but some of it, again, you know, just for people who are not medical. So Precious would make a lot of decisions on her own as a sole GP, whereas I would work as a team. So for me, actually, a lot of the a lot of the questions that you had, you know, that you had for yourself regarding COVID and what to tell patients, for me, I could always share this with somebody else at work, actually. So say, for example, a patient would call me and I wasn't really, you know, maybe something had changed in the last 10 minutes of that conversation. I could easily just turn back and there'll be somebody else sat there who said, oh, by the way, the government has just said this. So it's really, really interesting to see the differences in how, you know, and just in terms of how being where you are and where you work can change, you know, the things you're dealing with.
Okay. Honestly, in the morning, you would say, sorry to interrupt, in the morning, so you'd come in on a Monday and it would be everybody who's been to Wuhan, and then you come in on a Tuesday and it would say, now it's Italy, or no, now it's Italy in the last 14 days. So yes, there are people around you to ask questions and to support, but there was a sense that you just had to, you had to just keep up with what was happening. I knew about viruses, but I couldn't tell you. People would say, oh, how do you know I don't have it? Can you test me? And you're saying that's not what we're doing at the moment. And just being aware that people were asking questions, but then also just that regular keeping up to date with what's going on, so that I knew and I could actually give information that was correct at the time.
As best as you could.
And you know, I'm just going to touch on something else that Renua said, the anxiety within people around you, because remember that you work with staff who will also maybe have other mental health conditions or physical conditions or families and things like that. You can feel that because actually people were thinking they had to phone their GPs, and these are people who are either GPs or they work, you know, there are other people who are, so because, you know, and I just remember forgetting that the people who you work with also had it just brought it back. Also had things going on, and actually just to be mindful of that.
Yeah, I was actually going to ask about that. Obviously, you aren't isolated people. Yes, you have teams around you, and they'll be dealing with this as well, and this affects how you are dealing with it as well. So can you speak that a little bit? How is it that your environment was affecting you, and how are you influencing your environment? Like, what was the general sense of emotion around you? People panicking? Were people afraid to come to work? Were they huddled in corners, concerned for the well-being of themselves and their families when they get home? What was the environment like at the front line?
I think it's, definitely a range of emotions. That's what I'll say. Ranging from people who were feeling really anxious about themselves, but people who were really, just really grateful that they could be there at work and help in this, and willing to do anything at any point. Like there was a real sense of camaraderie amongst people that I work with. Like, a lot of people just felt really fortunate that they were able to, be here, come to work, help out, and do anything that they can. So definitely a whole host of emotions. I think the people who were dealing with a lot more emotions were mostly emotions for other people. So like, a lot of doctors have, also, they're also people, so they have, their own families. A lot of them may be vulnerable as well. A lot of them have kids. A few colleagues had pregnant wives, and so I think it was more the fear for their loved ones that was noticeable. In my experience, that's what I would say. And also, like, people's personalities as well. Some people, don't really do well with, like, we're prepared as much as we can through medical school and through our training, but, nothing prepares you for a pandemic like this ever. So, just dealing with the change, and bearing in mind that, we have to stay strong for so many people as well. So even we almost don't have an option to, mellow in our misery. Do you know what I mean? So like, no matter how I'm feeling, I still have to wake up the next day and go to work and put up a smile and be positive and look out for my colleagues and look out for my staff and look out for my patients as well. So you're dealing with, so you almost internalize your own emotions, if I'm being really honest, and deal with things as it presents on a day-to-day basis. And if you ask me personally how I've dealt with this, I would say it's really only the grace of God. And for me, it's really the grace of God. Like, I really just substituted any fear with faith. And it's just been encouraging to have friends and family who are immersed in God's word and God's love, and just having that around me was really, really, really encouraging. I can't even underestimate how much that's been helpful. Like, I'll wake up and my mom would have sent me a text or a prayer, scripture. Like, I was like reading Psalm 91 on my day, every day going to work, just in my head, and just like words of encouragement, words of truth. And at this time, you really want to, hold on to your faith and just remember God's promises. And God, God, like, none of this makes sense if you really think about it, but what makes sense is God's love, and that never changes.
That's true. You, Precious?
Yeah, I was just about to say, Renua, you stole my line. I mean, what is this?
Sorry. She's my friend as well, so I'm not
that kind of fear, faith over fear. And I sometimes, I remember the first week or so, we're still seeing lots of people face to face, and you really, in an everyday basis, you're just recalibrating every 10 or 15 minutes or however long the appointment is. Somebody comes in, has a situation, you deal with it, and then you kind of type up their notes, take a deep breath in, next, you just keep doing that. And for 10, 20, 30 people through the day, and then now you're doing that on the phone, so they can't see you breathing, but but you're kind of just doing that, and you recognize that actually the people around you, they dealt with a range of emotions. There were people who they needed to up their medications for the things that they were dealing with in their own life. There are people who were like, I really can't come to work. People who've been redeployed to different places, who they were saying, I was dealing with this, but I can't deal with this. Or people who are who have own medical conditions, which means that they can't do the job that they would normally do. And their family is saying, you're not going to work. And then they say, phone your GP. That's the baseline for a lot of things. Just phone your GP. I'm like, the GP is me. So lots of emotions. Lots of emotions and lots of different things, but recognizing that the word I would use, that even though, yes, it does affect us, and yes, we don't just ignore it, you just don't have the luxury of being able to, you know, somebody tells you something that's quite distressing to then cry, and then the next patient comes in to decide, give me 2 seconds while I'm wiping my tears. Oh, sorry, I just need to snort my nose.
Yeah.
It's, you know, you, as simple as I make that, I guess you're trained to be professional. You're trained to just, you know, housekeep, look after yourself whilst you're doing all these different things, and then actually just start again and remind yourself that actually the person in front of you is the person you're looking after. And yes, you can have your own emotions, and yes, there have been times where patients could see that I'm distressed or I'm upset, but often they recognize that you're humans, and sometimes being able to just put your hand in somebody's hand. There's not a lot of jobs where you can touch people.
Honestly, it's still a privilege. I still get to touch people on a daily basis.
You can put your hands on their shoulder to say, you know, at the moment, of course, your gloved hands, but that's not the point.
PPE, with PPE.
Exactly, with full gloves on your fingers, but the whole feeling of just being able to, sometimes that's good for me, just being able to put my hands on somebody's shoulder with permission, knowing when sensibly to do that calms me down as well. And so range of emotions, but being aware that you're the professional in this, and so you need to act that way. And actually, when they leave, you can de-stress and do all the different things you know you need to do best.
Okay, so let's park there for a minute. If you have to look after these people, go through these emotions, obviously, I'm assuming that both of you have some sort of well-being routine. So my next question for you is, how are you caring for yourself personally? What are those well-being, those things you're doing to stay well, mentally, emotionally, to come in physically, daily to work? What is your well-being routine like? Do you have one? Talk to us about that a bit.
So well-being is it's a term that has been thrown about all over, but I think is actually very meaningful and hugely important. And even within the medical world, we recognize how important just generally your well-being is, so much so that, you know, we're actively trying to improve well-being of doctors and nurses and healthcare professionals prior to COVID starting. So, you know, so that's definitely important. At work, things have definitely changed to incorporate our well-being and, you know, just really thoughtful things that have changed, and they're all very positive and welcoming by myself personally and by my colleagues as well. So there's lots of, you know, like tiny hubs and stations that have developed for healthcare workers at the moment, which is fantastic. I would say each trust does things differently. So within my trust, I feel I have been well supported, and I feel there are avenues as well. Do I need them? On a personal basis, I have a routine. Within my routine, I start my day with prayer. It's interesting because prior to this pandemic, my routine was always, I wake up in the morning, say a quick thank you, God, and then gym, and then work, and then I come back and do my quiet time in the evening. Actually, because I've had more time at home in the morning, I do my quiet time in the morning, and I might say I might change this after the pandemic actually, but I think there's just something amazing about waking up in the morning and just having that first time with God and in God's presence. So I definitely immerse myself in God's word and God's truth. I keep saying truth because it's really important at this time, to just immerse yourself in God and what he's speaking and what he's telling you, and also just just remind you of God's awesome love as well. So number one is quiet time with God. Number two is exercise. That is hugely important for your mental and physical well-being. Exercise induces endorphins. They're definitely happy hormones. And there's just something about, and for me personally, exercise helps me focus on, when I'm exercising, I don't think about anything else apart from the work that I'm doing at the time. So it definitely takes your mind off things. Eating well, hugely important. At this time, it's really easy to reach out and, reach for, all the foods that are terrible for you, like sugar-laden foods. Everybody's baking, which is great. That's definitely not a bad thing.
What are they baking with is the question.
What are they finding this flour?
So definitely eating, I would say, a colorful diet. And when you add color in your diet, you often have to add vegetables and fruits, because it's an orange or banana or peppers. So just make sure your diet is variable, and it really helps you internally and externally as well. And the other thing I have been doing is, actually it's been an opportunity to look inwards within myself, because, you're having all this time that you're not socializing with other people. So you're really forced to be your own best friend. And, and it's, I mean, good or bad, who knows? But I am definitely, I'm definitely developing a lot of, I wouldn't say new skills, but just a lot of new thinking pathways in my brain. Just reflecting on me as an individual and, what this all means. And occasionally I've been able to pick up one or two non-medical books, which is amazing. I haven't been able to do that all year. Again, only because I have the extra time when I'm not working to do that. So it's been, so those few steps helps.
Okay, fantastic. You, Precious, what's your well-being routine like?
So one of the things I like doing is I write quite a lot. I'm very much a reflector. I can see you guys nodding nodding your heads. I reflect on how things have been. So how did the day go? What went well? What didn't go well? How did I feel? What did I need to do differently? So sometimes you go into work one day and you think this is, I was anxious in that moment, and you just deal with it. And then I don't like to feel that way again if I can help it. So I think, right, what can I do differently when I do go into work tomorrow? What am I going to change and things like that? I would love to say I wake up every morning and and I, exercise and get my heart rate up, and yes, but actually I do enjoy walking. And actually I've been walking a lot more over the last few weeks than I would not normally do. Sometimes I just walk around and just kind of think about what's going on. So walking is quite a good thing for me. And this year, so every year I decide myself that I'm going to read the Bible in a year. And then by the time I get to February or March, sorry, please. So by the time I get to February or March, I'm like, God, I'm in Leviticus. I don't understand all these things. Who are these people? Why do these things happen? But this year I again, never give up. I was like, I'm going to read the Bible in a year, and I'm doing a devotion at the moment, which has a devotion attached to the reading, and that's been really good. And so I'm still doing that. And now we're moving, we're in Joshua, and I'm like, and it's saying be strong and courageous. I'm like, I can do this. so reading that and then sharing it with somebody else. And when you are encouraged by something, and when you do get a song, when you do hear something differently that is helpful, sharing it with somebody else. And one thing that for me I really, really enjoy is I enjoy people time. So if there wasn't a pandemic, I would be catching up with my friends. And so I'm doing that. I'm catching up with my friends in the evening, penning people in, video calls, whether it's cousins or kids or just lots of different things, just trying to do that as I would normally do. So my routine is doing what I know to do, which is really spending time praying, spending time in the Word as much as you can, but also just doing the other things. I've got a list of things that, in terms of what, advice for people to do. But generally for me, I'm learning that actually when I focus on what I need to do, learn the things I need to know, not go into work with uncertainty. There's no point me going into work having not read the latest guidelines, because that will make me anxious, because I can't do my job properly. And so doing what I know, waking up, going for a walk, whether in the morning or probably much later in the evening, just to de-stress, and actually just talking to friends and family about normal things. And that's been quite helpful for me. And of course, there are people at work you can talk to about as well. So that's my main thing at the moment.
Fantastic. So as we close, I just wanted to see if there's anything that you could offer people in terms of advice with dealing with this at all, mentally, socially. What can you say to people about how they could possibly cope in this current situation with the lockdown as well?